Hi, welcome to Clinician Conversations. So today I'm joined by Alex Bloor, physiotherapist. Hi, Alex.
Hi there, nice to meet you.
You too. So I want to dive right in. So tell me, in practice, what is the main complaint that you see? And if you can give me 3 symptoms that people will present with.
The 3 big things that people come in with: back pain, shoulder pain, and knee pain. Most people, I think, that come to physio come with pain. That's probably the primary thing that they want help with. It's not often you get patients without pain, but I think one of the other things that we see a lot of is, and we don't often explore this as much as we perhaps would like to, but patients' goals, what they're struggling with. It's very easy to focus in on a patient having pain. It hurts when I lift my arm up, hurts when I bend down. But what's actually brought that patient in to see us will normally be something quite specific. There's a certain activity they can't do. They can't play with their children. They can't do their sport. They can't go running anymore. And so I think those are the things that are often quite unique to patients, but really requiring us to delve deep into their history, their goals, and everything else to make what we do meaningful and relevant to them.
I suppose it's easy to think they come in with the pain and that's the bit that we're going to address, but what is their goal?
Absolutely. A lot of my background is in working in chronic pain. You often can't promise somebody they're going to be pain-free. So it's about, and that's one thing I absolutely love about my job is that you're working with real people and you're helping them to make the most out of their lives, rather than just seeing another knee, another shoulder, another back, or whatever else it may be. And I think that's what makes the job so rewarding. And I think that's why it's so important that everybody talks about therapist-patient relationship. And it's such a massive thing. You've got to have a good relationship with the person you're working with to get to where you want to be with your rehab.
Somebody's got pain and is struggling to move and they're at home and they don't know what to do. At which point do you think they need to see a physiotherapist?
The first thing with anything is you want to make sure there's nothing nasty going on, nothing serious. That's where the NHS conditions site is actually really useful. I signpost a lot of my patients to there before they come and see me, because it breaks down. You know, if you've got back pain, these symptoms phone 111, these see your GP, and these go to A&E. So first thing is you rule out anything that needs urgent medical intervention. But then beyond that, I think this is the beauty of physiotherapy, is there's such a broad range of things we can help with. You've got respiratory physios that do cardiac and pulmonary rehab classes with people in the community. You've got your neurophysios helping people post-stroke or with long-term neurological conditions. And you've got your musculoskeletal physiotherapists. So I think it's really looking at what that person wants to achieve from seeing physio. But physios, we are movement specialists. That's what we do, is we help people to move. And I would say particularly in the community setting, anybody with pain, movement, physical issues, anything like that, physios are a good place to start. And I think, as you say, that the challenge with that sometimes is finding a physio that specializes in that area that you're struggling with. Respiratory is one. It's not my specialty, but I had somebody the other week who approached me and said, "Hey, I've got a bronchiectasis, COPD. Can you help me with this?" And it's a case of knowing where to signpost those guys to if that's not your area. But physios can be involved really with most things physical. You've got burns, plastics, hand therapy, amputees, a real wide range of things.
It's really interesting. Do you see a lot of patients that come and they have been waiting longer than they should to get the care and thought, I'll just leave it and I'm sure it'll be fine?
Yeah, absolutely. And I think in this country as well, we see a lot of that. It's almost a bit of a cultural thing. I think we're used to that over here. When I worked overseas, people would sprain their ankle in the morning, they'd be in physio in the afternoon. But over here, I know my parents are the same. Oh, it'll get better, give it a few weeks. And in a lot of cases, it does. But the sooner you can get in and start treatment, the better it is. And I think that's something that's such a challenge at the moment with the healthcare system, with accessing care, is a lot of people wait a long time. And I think that's what makes a lot of people come and see people privately. Is a lot of the people that come and pay me privately are your bricklayers, your labourers, your plumbers, your electricians, your people doing manual jobs, who are saying, look, I've got this pain, I work for myself, I'm not earning any money at the moment, I need to get better, and they're waiting several months to see a physiotherapist.
And with regards to the profession itself and the misconceptions around it, when practicing as a podiatrist, it was, podiatrists just cut toenails, and obviously that's not the case. So are there misconceptions in physio?
Yeah, when I was training, I think a lot of it was that we're massage therapists. I do feel like that shifted in recent times, and a perception that a lot of people come to me with, or I hear a lot of people talk about, is, I went and saw the physio and they just gave me a piece of paper and sent me away. Or that they gave me a piece of paper with some exercises, go away, do them, and that was it. And I'm not saying that's what goes on all the time, but that's certainly what a lot of people seem to have take from that, or that they perhaps come to expect, is they'll get a piece of paper with some exercises on. And in a lot of cases, that's really helpful for people. I think we've got to look at what we're trying to achieve with patients and patients' expectations. And I think that's really important. It's a bit like you go to the doctor. Sometimes you go to the doctor just wanting some reassurance that this isn't something serious. Sometimes you go just wanting a bit of advice. What can I do to help manage this? And sometimes you go wanting intervention. And I think it's the same with physiotherapy. Is there's so much information out there now. It's so easy to put into ChatGPT or Copilot or Google or whatever and Google your symptoms, and there might be a load of stuff that's not that good, but with a bit of effort, you can probably sift through and find what the evidence tells us to do for a condition. But that's often not what people want. People want somebody to communicate that to them, to sift through all the noise and say, hey, look, in your situation, this is what's gonna help you, and this is how we can do that. And for some people, that might be more input. For some people, that might be less. But I do believe that physio should be a means of helping people achieve their goals. We shouldn't focus on what we do. So I do exercise, I do manual therapy, I do whatever. We should be focusing on why we're doing it. This person wants to play with the grandchildren, get back to running, play sport, whatever it may be. What's the best way that we can take the evidence for that condition and this person and marry them up and help this person get to where they want to be?
So what 3 simple things could people do to look after their own physical health?
I think this is where physiotherapy is very broad. There's lots of specialties, and that's one of the things I really love about physiotherapy, is that you can go anywhere with it. My journey through my career has not necessarily gone where I thought it would go. I've fallen into roles that I've absolutely loved. But I think we're part of a bigger machine of health, and you can't separate the physical from the mental, from the psychosocial, from everything else. So the biggest things you can do is eat well, sleep well, and move well. Optimize your diet, eat as healthily as possible, get enough sleep and rest and downtime, and that's good quality rest. Move often, change position regularly, stay active. And that's the big thing about that, is finding something that you love doing. There's not necessarily a better exercise and a worse exercise. It's finding something that you will do. If you tell a patient that, right, you need to go to the gym 5 days a week, and that's not something they enjoy doing, they're not going to go. And the evidence supports that. Is find an exercise, find a sport, find something that person enjoys doing. It could be walking with their family, it could be cycling, it could be whatever, but find some physical activity, gardening, or whatever it may be that they enjoy doing. And then it's other things, maintaining relationships with people, a work-life balance. And I think that's where the biopsychosocial model is so important with people, is we can't just say, right, if we do these exercises, we do this physical stuff, that's going to fix everything. Quite often we need to consider those things, and we may or may not be the best person to advise or guide people with those things, but we should certainly be able to signpost people and say, hey, this is where you can access dietary advice, smoking cessation, sleep hygiene, whatever it may be with that person.
Yeah, and that actually speaks to what you mentioned earlier about having that therapeutic relationship with the patient, building that trust so that you can find out what things they enjoy. You're not just saying, well, do this one thing and giving that to all your patients, and that's the only prescription that you have. It's adjusting that accordingly.
Very much so. And that's where it's not about hoarding patients as well and saying, yes, come to me, we can fix all of these things, but I think it's knowing when actually perhaps this other person is better for you to see at the moment. When I was working with pain programs, we would do that quite a lot. Maybe right now, let's get your mental health sorted out, and then when that's sorted, come back to me and we can do some rehabilitation.
So what led you into physiotherapy?
There was two main things. I had a year out just working. I wanted to go and do sports science, but I didn't really know what I wanted to do with that. I was just into sports, and I was very, very involved with Special Olympics, and I actually met somebody through Special Olympics who was studying to be a physio and was like, hey, this is what I'm doing. And that really left an impression on me of like, oh, that sounds like it might be worth looking into, because I wanted to work with people. I didn't want to be sat behind a desk. I'm sociable. I like to be up and about. So that typical stuff of, I want to help people. I wanted something that was rewarding, that I felt was benefiting people. But the other thing with physiotherapy is the scope and variety. You could be on intensive care, suctioning mucus off people's lungs with really acutely unwell people and supporting them through that journey. Or you could be in pain management, where I've spent a lot of time working with people with chronic pain. You could be on a neuro ward with somebody who's had a stroke. You could be in palliative care. You could be in the community. You could be anywhere. That really appealed to me, that not being tied down to one area, having that breadth and variety. And I love working with people. There's the diagnostic challenge that we have of what do we think's going on. I enjoy that to some degree, but I also enjoy that working with an individual and helping that person, because otherwise physio is just knees, shoulders and backs. And that's what you see. And most knees will be very similar things. Most backs will be very similar things. But what makes physio fun and exciting is helping that person with that problem. If you get an elite athlete with an ankle sprain or a single mum of two with an ankle sprain, they might be exactly the same injury, but they're going to need very different management. And so finding what's important to that person and helping them through that journey and adapting your approach is where the fun comes in. Because otherwise you might as well say, here's your piece of paper, go and do that.
Yeah, there's your prescription. And so you mentioned your specialism. Is that chronic pain then?
Yeah, I mean, like I said, I've been fortunate to do quite a few different things. I've done rotations, I've done a lot of MSK, FCP, diagnosis, triage, but I did spend a few years in pain, and that's certainly... I don't know if I'd necessarily call myself a specialist as such, but it's where my interest lies. I really find that a very rewarding space to work because you are building relationships with people, and those relationships are much more long-term. You know, when you take somebody from struggling to do anything almost to finding something that's really meaningful to them and get them on board with that and get them back into that, I find that really rewarding.
And so you're quite a busy man, Alex. So you do a phys ed podcast, supporting and students and clinicians. You're also a lecturer and you're working in private practice as well. How are you fitting all that into your life?
With some difficulty. I think it's one of those things, you kind of immerse yourself in it. In some ways, the more immersed you are in it, the just becomes part of your life. And I think if you enjoy what you do, it doesn't feel like work. So for me, family are important, and you've got to balance your time and have time for yourself. So for me, for example, I will often tend to keep the weekends free for family. But, you know, I think if you're in that bubble consistently, I'm teaching something in the morning, I'm then seeing a patient in the afternoon. I enjoy that. I enjoy working with students. I enjoy teaching. The YouTube channel that I started out because students are asking me for videos, resources and stuff. I'm very fortunate that I really enjoy the jobs that I have, whether that's teaching or working with patients. And the great thing about working privately is that you can be yourself. You can be the physio that you want to be. I can work in the way that I want to work. So I can work the hours I want. So that flexibility works really well. And yeah, some of the people I've spoken to on the podcast, you wouldn't have those conversations with them clinically in any other space, but I'm very fortunate to get the opportunity to do that.
So referring to podcast, I know it's a great way to get the message out, and it's actually one of the reasons why this channel was created, so that we could raise awareness for Quality Health Finder. As you know, we're currently inviting physios to register on the platform so that they can advertise for free. So what made you join the platform, and why should other physios follow?
I think visibility is something that's so hard, especially nowadays, because there's so much noise out there. You put into Google, there's so much stuff everywhere. And I'm not saying that it's all bad. There's a lot of good stuff out there with algorithms, AI, all the rest of it. To find what you want sometimes can be really challenging. And you know, for me, I'm a physio. I like teaching, I like educating, I like working with patients. I'm not big into marketing. So having an organization there to support you with that, I think is really great, but particularly if it's free. If somebody is going to put me out there and push my services, then fantastic. That saves me a heck of a lot of time, money and effort doing that myself, and being able to have a directory and be like, right, this is what I want. This is what I want to achieve. Who's the best person to do that? It might be a physio, it might be a podiatrist, it might be a dietitian actually when you break things down. So having that network around you to not only mean that patients can say, this is what I want, and here's somebody who looks like they can deliver it, but also to meet somebody and say, hey, actually, perhaps this is what you need more of at the moment. Let's see if there's somebody else locally that we can access for you is really powerful. We should be collaborating with people, not hoarding patients, and that we should be playing to each other's strengths. And I think that relationship is so important, of knowing when you can support somebody and knowing when perhaps somebody else can support them.
Absolutely. Thank you, Alex. It's been really interesting. And so if people want to get in touch with you, what's the best way for them?
So the best way, ABPT is the name of my company. If you put an ABPT physio into Google, you'll find us on there. from the webpage. There's links to the YouTube channel. We've got the podcast that comes out once a month, sometimes twice. And I don't just have physios on there talking about physio stuff. I've had dietitians, podiatrists. I've had patients on there. We've done learning disabilities. It's more of an allied healthcare podcast, really, but it's specifically targeted towards students, new grads. It's on Spotify as well. I'm on LinkedIn if people want to find me on there.
Wonderful. And so once we get some more physios and podiatrists and, as you say, other allied health professionals on Quality Health Finder, then we'll be opening up to the public. So like and subscribe. Thank you, Alex, for your time. I'll make sure that I put your information in the description below as well.
Amazing. Thank you, Lorraine.